What distinguishes each type of stroke? Imagine your brain as a busy city with roads carrying vital supplies. When those roads get blocked or burst open, the city faces a crisis. That's what happens in strokes, which mainly come in two types, ischemic and hemorrhagic. Understanding what sets them apart can help you recognize symptoms and seek prompt care. An ischemic stroke happens when a blood vessel in the brain gets blocked, usually by a clot. This blockage stops blood flow, depriving parts of the brain of oxygen and nutrients. Most strokes, about 87%, are ischemic. They can happen in different ways. Sometimes a clot forms directly in a brain artery, called a thrombotic stroke. Other times, a clot or debris travels from elsewhere, like the heart, and blocks a brain artery, known as an embolic stroke. Symptoms often include sudden weakness or numbness on one side of the body, trouble speaking or understanding speech, vision problems, and loss of coordination. The severity depends on how much brain tissue is affected and how quickly treatment begins. Within ischemic strokes, doctors classify them based on the area involved. Large strokes affecting both the middle and front parts of the brain are called total anterior circulation strokes. They cause widespread weakness, visual loss, and sometimes language or spatial issues. Smaller strokes, called lacunar strokes, involve deep brain areas and usually cause pure motor or sensory problems. Partial strokes affect fewer areas and may cause less severe symptoms. Hemorrhagic strokes are different. They happen when a weakened blood vessel bursts, spilling blood into or around the brain. This bleeding can damage brain tissue directly and increase pressure inside the skull. Hemorrhagic strokes account for about 13% of all strokes but tend to be more deadly. They come in two main types. Intracerebral hemorrhage involves bleeding directly into the brain tissue, often caused by high blood pressure or blood vessel abnormalities. Subarachnoid hemorrhage involves bleeding into the space surrounding the brain, often from a ruptured aneurysm or abnormal blood vessel connection called an arteriovenous malformation. Symptoms usually come on suddenly with a severe headache, vomiting, loss of consciousness, and rapid neurological decline. The key difference between hemorrhagic and ischemic strokes is the cause. One is blocked blood flow, the other is bleeding. Treatment strategies differ as well. Ischemic strokes often requiring clot-busting medications or mechanical removal of the clot, while hemorrhagic strokes focus on controlling bleeding, reducing brain pressure, and sometimes surgery. The prognosis for hemorrhagic strokes tends to be more serious, with recovery often more challenging. There are other stroke-related conditions to know about. Transient ischemic attacks, or mini-strokes, happen when blood flow is temporarily blocked but resolve quickly without lasting damage. They are warning signs of future strokes and need urgent medical attention. Sometimes, the cause of a stroke remains unknown even after thorough testing, called a cryptogenic stroke. Strokes in the brainstem can cause severe symptoms like paralysis or being unable to speak, but still stay conscious, a condition known as locked-in syndrome. Recognizing the differences between stroke types is vital for quick diagnosis and effective treatment. Brain tissue is highly sensitive to oxygen loss or bleeding, so early intervention can save lives and reduce disability. Always remember, if you or someone else shows signs of a stroke, seek emergency medical help immediately. Consulting healthcare professionals is essential for personalized care and the best possible outcome.